Well, it's already almost 2:05. We'll start the webinar. As I said at the beginning, first of all, I would like to introduce myself. My name is José Jonay Ojeda. I work at La Paz University Hospital. I am currently the co-coordinator of our network of TransplantChild, and you may probably have seen me before because I'm usually in charge of the monitoring exercise that take place in our network, and we usually do this webinar once a year in order to let you know what is going to happen when we try to collect not only the activity of our network, but also all the activity that is related to the project and to the functioning of the ERNs that all the networks collect at the end of every year. As I said, this webinar has a principal aim. We want to inform you. It will be recorded, as I mentioned, so be aware that you can be recorded and your microphone is off and your camera, if you want to, is also off. It will be also on our website and you will have it available. So when you undertake this task, you can review it and see it as many times as you want or as you need. As I mentioned, we just a first slide in order to know if I may have conflict of interest. Well, I work at La Paz Hospital. My specialization field is preventive medicine and public health. I also work in the Universidad Autónoma de Madrid, and I also have some collaborations with the Spanish National Public Health School and also the Spanish Health Ministry. I believe I have no other potential conflict of interest in this topic. And I also have, as you know, a special interest in monitoring, evaluation, and at the end, what we want to do is to add value to the things that we do in our hospitals and the things that we do in this common big hospital that is our network. Just to give you an overview, of course, it's not the first time we do this monitoring exercise. The last time we did it, we counted, joining the activity of all the 40 centers of the network, we counted 2,500 new patients last year. That was 2023. And as you know, we have more than, we have 135 active transplantation programs in the network in all the fields. I mean, not only solid organ transplantation, but also stem cell transplantation. You know that this is a field of, a core field of our network. We do it in a transversal approach and multidisciplinary approach. Probably you know it from before. Monitoring is not new in the networks. It started in 2018. The network started only 1 year before. Since the next year, 2019, we have been collecting the activity in all the networks. The last one took place last year. From January till mid-April, we collected the activity of 2023. Okay, so that's not correct. It's not 2024, but 2023. And as you also may have heard from before, this is based on a larger strategy that is called Assessment, Monitoring, Evaluation, and Quality Improvement System that is in place from the beginning of the networks, and that, as you may remember, we will see in the next slide, doesn't only intend to collect information from our hospitals or from our networks and the coordinated centers, but also in the near future from patient associations and also from the member states. We usually, when we talk about measuring and evaluating and the added value that we may provide to our patients, to our health systems, we have to have that wide approach, and it is expected that we will start to provide or to ask for information to all the stakeholders involved in the ERNs. As you may know, last year we have some changes in the monitoring system, because at the same time that we collected the core indicators that we were collecting from the beginning, we also added some key performance indicators that are integrated in the grants that the DG provide in order to sustain the networks. That happened for the first time last year, and luckily this year we don't have changes. The system, the monitoring exercise will be very similar. No big changes, no changes for this year, and that is a good news, because when we monitor or we evaluate the activity of our organizations, it's good that we keep some things stable, at least in medium term, in order to compare from one period to another one. You may know this AMEQUIS strategy. As I mentioned, actually we gather information from healthcare providers through these exercises, but also from ERN coordinators. But in the near future, it is planned that information will be gathered also from patient associations and patient representatives, and also member states. This is the expected timeline for this year monitoring. It was presented by the DG Santé last December in a webinar that you probably had the opportunity to attend. As you see, it has the same scheme as it happened last year. In January and February, it will be the period where centers, healthcare providers can submit directly information about number of patients and use of ORFA codes in their centers in every ERN, as it happened last year. This period will finish at the end of February. Okay, we will see in the following slide, we will provide some information so we can help you from the coordinating center to do this task. But as I mentioned, there's no changes from last year, only that you have to check out if the person that was reporting the data last year has still access, or there has been a change in this person responsible. So if there has been a change, please let us know, or if you have problems, please let us know, because you will have all this month and the following month in order to provide this data. As you may know from last year, the month of March, it will be the second stage, as it will be the time for ERN coordinators in order to submit the data. We will provide all the data that is required in the monitoring system, not only new number of patients and the use of ORFA codes. We will also have the chance, if you have not been able to provide this data in January and February, we can add it later on. And we can also correct some data in case you realize later when you answer or when you collect the information for our TransplantChild survey, that there's something that you may change, we need to change from the information you have provided to DG Santé. You can also provide that information to us through the survey or through emails, and we will correct it in the monitoring platform in the month of March. Just to remind you, as I mentioned, there is a link that we will remind you in information that we will send you after the day of tomorrow. This link direct to the monitoring platform that DG Santé provide all the networks in order to fulfill this monitoring exercise. Of course, as I mentioned, if you have changes in the reporter that the previous year did this task, please let us know, because we have to grant that access from the coordinating center. As we mentioned last year, there can be several ways healthcare providers can appoint these reporters. There can be, I mean, the most common is that every network has a reporter that is different from, I mean, in centers who may have more than one ERN, there can be several reporters, one different from each ERN, but in some centers there is only one reporter for all their ERNs that center is participating. So anyway, no matter the way you have it organized in your healthcare provider, please, as we were saying, check out that the people who did this tag last year has the access. There has been no changes, and in case you have problems or there has been changes, please let us know. You probably know that there's an EU login account. It's common to all the EU IT platforms, and there's information available in the European Commission in order to get that. But of course, if you have also problems, just let us know. We may be able to help you too. This is the form that you will have available as healthcare providers. As you can see, you will have to provide the total number of new patients that you may have incorporated, in our case, in transplantation programs in 2024, okay? And if you use or don't use ORFA codes. It's very simple information that we will have to provide until the end of February. And as we will see through this presentation, what we will propose you, as we did last year, is that you provide this information at the same time, or at least in a coordinated way, as you will answer also our survey. As you know, DigiSante has the interest for the global number, but in all the networks, we usually specify different groups of diseases, or in our case, transplants. So we will ask for this data in our survey. So there has to be some correspondence with this number and the numbers we will ask for each of the transplant type, transplantation programs, depending on the type, that we will see afterwards in the survey of TransplantChild that we will also show you afterwards. Just to remind you, this is the definition that we use in TransplantChild in order to measure this number of new patients. As you know, in our case, new patients are those that are that come for the first time to a TransplantChild hospital in the specific time frame. We are talking about 2024. And at the same time, what it can happen is that this new patient comes to us in the pre-transplant care, is evaluated, and it is considered that needs transplantation. So it is included in the waiting list. That's the concept that we want to focus this year. I mean, we are interested to know these new patients when they are included in the waiting list, okay? Because last year, some of you told us that depending on the type of transplant, there could be differences in the whether they could be considered new patients only when they are evaluated for transplant. So in this case, we will count them only when they are included in waiting list. At the same time, it can happen that that patient is not transplanted in your center or in a TransplantChild center and needs follow-up, or it can need retransplantation and it was transplanted in other center that was not TransplantChild. So in that case, if that is the first time that it comes into contact with your transplantation program, then we consider that a new patient in post-transplant care. Okay, that's something that we have been improving in the last monitoring exercises. We believe that in the last year it was we got a better measure about these two indicators. I mean, about these two specifications that apply to our network, and we hope that this year you have no problems about identifying what are new patients for us. And in case you have problems, as you did last year, please you can ask now at the end of this webinar, or you can send us an email or tell us any problem you may have about this. Because as we have been mentioning all these years, this is a very relevant indicator for the European Commission, and we have to be very careful that we measure it in a very rigorous way. Okay, we have to be very careful in order to measure these numbers. As I mentioned, in March, we will, as the coordinator center, we will be providing extra information that we will get not only from the activity that it is fostered by the working packages of our network, but also from extra activity that we will get from the survey that TransplantChild sends you every year. Okay, we will talk about that survey now, but just to remind you that this survey, along with the activity that we have from the different working packages, we will get information about the activity in the CPMS, the activity about education and training, clinical or trials or observational prospective studies, publications, the activity in Peter, our ERN registry, other documents that we may produce and that are for professionals or patients and that are acknowledged by TransplantChild, and also congresses, conferences, or meetings where you have shared the activities of our network. We also measure the visits that our website has, and documents that are downloaded from the website, the participation in our webinars like this, etc. Just to remind you that in the working package 3, the evaluation working package, from the beginning, we also work on other specific indications for our networks, and some of them we will ask for you. We will ask for that information in the survey. But these are specific indicators that every ERN asks for. They are not the core indicators for the networks and the indicators that come together with the project. You will remember this from previous surveys. This is going to be the initial web page when you access to the TransplantChild monitoring survey of last year. We will send you tomorrow to all the representatives from the centers and the people that we have contact. We will provide you with a link and additional information that, as I was saying before, we provide some clarifications that we hope that will help you do this task. And this survey will start tomorrow and finish by the 14th of March. Of course, this year we did not do this webinar before because we were expecting this DigiSante presentation that finally took place last December 17th. As I mentioned, there was no big changes. There were no changes in the monitoring platform. So what we did at the beginning of this month, we review both the survey and the clarification documents. We share that documents with the hospitals that are also leading the working packages, and well, that's the reason why we are doing this webinar today, and the survey is starting tomorrow. As we did in other years, and as I mentioned, there has been no changes from last year, we will ask for full year transplantation activity. That means that we will ask for the number of transplants that you have done last year in any of the transplantation programs that are active in your centers. We will also ask, as I mentioned, about the new patients included in the transplantation programs. As I mentioned, we do a differentiation between pre and post-transplant care. If you have any doubt, please, we can talk about that at the end of this webinar, or just write us an email if you have any doubts. But we have prepared that clarification document in order to help you solve those doubts. We will also this year again ask for survival in solid organ transplantation, but also in hematopoietic stem cell transplantation. We have added some clarifications because last year there were doubts about until when I could do the analysis, the survival analysis, and we recommend you to provide us with the last available survival analysis that you may have, and that survival analysis not to be older than in the last 20 years. As I mentioned before, we will ask you directly to each center if you use offer codes, if you have done specific education and training activities acknowledged by TransplantChild, also research activities, the activities in relation to clinical practice guidelines or other clinical decision-making tools. If you have presented TransplantChild in conferences, congresses, and meetings, and well, other information that will also give us information to the working packages as the participation in research consortiums, any certification that you have active in your transplantation programs, and if you also have done specific activities or material aimed to patients. As I mentioned, it's very important that if you provide us with this kind of extra information, you help us with links, for example, to publications or documents that you have available, so we can have proof that these activities have taken place last year. The deadline for all the full members and affiliated partners, that you know that we are in total 40, will start tomorrow and will finish Friday, the 14th of March. As I mentioned, please report data where there's available evidence that is expected from DigiSanté, especially when they do these evaluation exercises that some of you have already participated in. So please keep that in mind. As I mentioned before, there has been no changes in the format. We have done some changes in the clarification document that we will provide you tomorrow. And if you are not able to fill data during stage 1, we will do that work in stage 2. But we recommend you to do an effort and put that data before the end of February. Although you may not be sure that will be the total number or the final number. As I mentioned, as coordinated center, we will have the opportunity to update that data in March. So please try to access the monitoring platform of the DigiSanté and to put that information there directly, because well, that is registered, and well, as you know, you are expected as members of the networks to have active participations in all the activities, including monitoring. As you know, we usually collect this data at the beginning of the year. There may be some extension. We will talk about that. That happened last year, but we will recommend you not to wait for that extension. That last year happened in the first 2 weeks of April. And after that, we will do some internal work, not only in the next Board of the Network meetings that we will have during this year, but also in the meetings that we do in the Working Package 3. In summary, we want to stress out that the monitoring exercise from the DigiSanté and the TransplantChild survey will be similar to the last year. Again, this will be the second year where you will have to directly fill information into the monitoring platform of the GSANTE. Please be sure that you are able to access this platform. If not, contact us. Remember that you can also contact your operational area manager. They usually help us as coordinating center in order to make a follow-up of your participation in the monitoring exercise. And of course, they can also help you in this, but as I mentioned, you can also contact us, as we will be in charge of filling this platform in the month of March. Again, we will do the survey, as all the networks are doing, because as networks we have some specific indicators and some additional information that we collect, as you know, and we expect you to participate also in the survey of TransplantChild. That's also information that we will have registered. And as I was mentioning all the time, I mean, if you participate in the networks, if your center does it, you have to be able to do this monitoring exercise. So please let us know if you have any problems. As I mentioned, operations areas will be also supporting these tasks, and with our help, we hope to achieve good results as we did last year. You saw at the beginning of the webinar that if we add up all the activity that we do in our transplantation programs, we are stronger, and we can achieve greater goals. No, not only in relation to the GSANTE, but also to the other stakeholders that are in relation to the networks. Just to remind you, you will have an operational area manager. As I mentioned, they will also help in the participation of the monitoring, as they did the previous years. And remember to check that you have access to the monitoring platform. Of course, don't wait until the end of the period. Identify if you can provide us as coordinating center some activities that you have done and that is in relation to TransplantChild, so we can add that activity to the activity that we have collected in the technical secretariat. And again, we recommend you not to wait until the 15th of March in order to answer the survey. Please take a look at it tomorrow or the day after, so you can, if you have any doubts, you can contact us. Probably there will be some extension. It happened last year, but we cannot be sure that will happen also this year. And of course, all this information has already been taken into account when the evaluation of the first 5 years of the networks took place. There's also a monitoring working group that share all the networks, that also monitor the activity of the networks at global level. And if we participate in the monitoring and we give information of what is happening in all the networks, we will give additional reasons to Europe in order not only to keep maintaining the networks, but to give extra resources at national, at European level, in order to further improve the activities that we have at networks. Just, I want to thank you all. This was a group photo of our last in-person board of a network. Of course, this is only possible if we join together in the network. I want to thank you because this is an additional effort that you have to do for TransplantChild, for the networks, but as I mentioned, is the way forward to keep putting this topic at the European level and also at the member state level. And I think I'm going to stop now.